So to a psychologist, the linking of data is indeed a commonplace. It's how we understand everything about ourselves, about beauty, and about groups that are emerging around us, such as those who are homeless. It's a modern plight, and received a large infusion of attention in Vancouver around the Winter Olympics, which of course brought millions of people together, but were also a catalyst for research involving subgroups that were left out. In our case, it was people experiencing chronic homelessness, mental illness, and a variety of other health-related challenges. We mounted 2 randomized controlled trials involving 500 people. Using diverse sources of information, we talked to people extensively, but tonight I'm going to restrict the focus to the story that we can generate looking only at administrative data. Participants in these studies had been homeless for on average about 11 years. The majority were diagnosed with schizophrenia, and they were grouped according to need level for intervention. They were randomized to either a choice of housing and supports or to treatment as usual in the city. We recruited from shelters, the streets, police outreach teams, and other sources concentrated in the downtown east side of Vancouver and a few other areas surrounding our location here. Then in the experimental conditions, we offered people a choice of housing, and look where they went, everywhere. But very few chose to live in the neighborhoods where they had been homeless, which made us wonder, where had they been living previously? And this is where further data linkage and the most intensive data linkage comes in. With participants' consent, we examined their locations as well as the types of publicly funded services that they received over a decade or more before they entered the study. And this includes all publicly funded health-related services, justice system encounters, and the receipt of welfare and other financial assistance for shelter. Over that period, we see a marked increase in the percentage that received care in the downtown east side neighborhood in red, rising from about 12 to 56%, and a commensurate decrease in the percentage living outside of Vancouver, from 40% to somewhere less than 10%. Indicating a process of migration over many years. And why did they move? Well, in all likelihood, not for their health. The physician visits per person tripled over the 10 years preceding our study, coinciding with the period of homelessness and migration. It's from about 18 to 56. Number of days spent in hospital also rose sharply over the same period, reflecting declining physical as well as mental health and consistent with the well-known premature mortality in the subpopulation who are homeless, mentally ill, and using various drugs and alcohol. Drug types and costs also increased quite markedly. This is shown in Canadian dollars. And knowing that the sample were chronically homeless, this slide alone raises questions about the likelihood of adherence, effects of polypharmacy, and really the overall effectiveness of the medications that were prescribed. Finally, income assistance increased in frequency to, on average, 10 out of 12 months a year, but perhaps more than anything, this slide may illustrate the current level of support is insufficient to allow many people to rise above homelessness. So what happened after the study began? Were these trajectories inexorable? This slide suggests not. Compared to the year before recruitment, emergency department visits continued to increase in treatment as usual, in red, but declined sharply among people who moved to scattered sites. Similarly, criminal convictions were significantly impacted and reduced in the groups that were randomized to our intervention conditions, but rose in TAU, reminding us that social determinants of health are also social determinants of personal and public safety. So returning to the theme of migration, well, this is really a data mashup. Fish, West Coast art, cheese, and money and housing. And the Gestalt is summarizing all of the findings that have preceded. Here, we turned our attention to where people had been before the study, and where similar people were, pardon me. So we used these criteria to identify people who may be eclipsing the resources and tolerance of neighborhoods around British Columbia, finding that individuals meeting those criteria, first of all, numbered about 2,000 out of our total population, but they were located everywhere. And the highest per capita rate was not in urban centers, but in more rural regions such as the north, where the rate was actually twice that of the Vancouver coastal area. And this finding of regional distribution could hold some clues that help us understand how a period of substantial investment in housing and mental health in Vancouver could be perceived by the local police as a time of escalating homelessness and an increasing crisis of mental illness. Using these types of anonymous data, we're able to specify locations and concentrations of complex need, and we haven't done this, but we can begin to use this evidence to inform more targeted strengthenings of housing and other determinants of health that may impact migration. The snows have melted, the winter games have come and gone yet again, but among the legacies of the Vancouver Games are a number of insights toward ending chronic homelessness, and in large part we've discovered along the way that that legacy is animated by linked data. Thanks very much.